My sense of humor, because of what you were saying, is that I will give a lecture on PMS, the practical, the mystical, and the spiritual. And I would have to say to all of us that live by your experience, not your beliefs. Because I hear from so many frustrated patients because they can't communicate and talk to their doctor because the doctor, has never experienced what they're talking about. We get information, we don't get an education. A sentence I like very much, I can't remember where I came across it, was that we are trained to treat the result and not the cause. I learned to ask people, what's happened to you in the last year or two in your life? What may have made them vulnerable to get sick at a certain time? And many doctors said to me, you're blaming your patients. No, I'm not blaming my patients. But think of this ad that was in the New England Journal of Medicine. I'm depressed. This is from Sandoz Pharmaceutical Company, New England Journal of Medicine, a few years ago. I'm depressed. I went to see my physician. I said, you've got to help me. He prescribed an antidepressant. I feel better now. I wrote to the journal and to the pharmaceutical company. I said, do me a favor. I've had a tragedy in my family. That's why I'm depressed. I go to my doctor, and he doesn't even ask me what's going on in your life. He just says, here's a pill, goodbye. Could you put in another sentence, please? It says, sit down, tell me what's happening in your life. And they cancel the ad. But I've learned to ask. Yes, guilt, shame, and blame are a real issue here because how you're brought up. I send 100 letters to people with cancer way back before I wrote my first book. So this goes back almost 40 years. And let me take a step back and tell you why I did that. I went to a meeting that was run by Dr. Carl Simonton. He was a radiation therapist, wrote the book Getting Well Again, helping, empowering cancer patients, teaching them about imagery and so forth. I was the only doctor out of 125 people in the audience. That blew my mind. That not one single oncologist in all of the state of Connecticut came to the meeting. But sitting around me now were my patients. So one recommendation I would give any doctors listening to me is put your desk against the wall, actually any profession. If you have a desk, put it against the wall so there's nothing separating you from yourself and the people you take care of. I did that. It confused a lot of people when they came in my office. But why did I do that? Because everybody was sitting around me. And one young woman with breast cancer said to me, Bernie, you're a nice guy. I feel better when I'm in the office with you, but I can't take you home with me. So I need to know how to live between office visits. That changed my life because, well, I changed my life, but that comment made me think differently. I thought, okay, I don't have to feel like a failure. If I can help people live, I may not cure their disease, but I've done something for them.